Hello everyone, I am Dr. Chaithra. There are various categories of patients. When we come to donor sperm, it is when we do semen analysis and we see azoospermia. That means there is no sperm seen in the semen sample. And when we do certain other blood investigations or scan, we will know, okay, it is a testicular failure. We will not be able to retrieve sperms out of the husband. So that is when we give them the option for donor sperm. If at all we have the option of getting the husband's sperm with some medications or whatever, we try that. If nothing happens, nothing helps, then the last resort will be donor sperm. And sometimes there will be sperms, but the quality will not be good. Either when they give the sample or when we do TISA process, that means that directly taking the sample from the testis. When the quality is very bad and it looks like it is going to affect the embryo development, that is also one of the times that we may give the option for donor sperm, keeping in the mind that it will affect the embryo quality. So coming to donor egg, donor oocyte. So whom do we suggest that? Whenever we are aging and reaches menopause, that means our egg reserve has been over or come to an end 5 or 10 years prior to that. If we reach menopause by 50, 51, maybe when we are 40, 45 itself, our egg reserve is over. So some patients, they will have very long period of married life, then they would have tried any other treatments, but maybe due to financial reasons or some reluctance, they wouldn't go for IVF initially. But then when they are 40s, 45, then we do the scan and the ovaries are atrophic, means there are no follicles in that. So that is when we suggest them donor oocyte. Another factor is sometimes when young couple, there is something called premature ovarian insufficiency, means in them they have the tendency to attain menopause before 40 years. So it can be any age. We have seen cases even newly married, maybe they are 25, 23, 30 years. All these are not old age for getting pregnant, but in this POI cases, the egg reserve will be less, means they are equivalent to that 40-45 years of age, but they are going to attain the menopause early. In those patients also, when the egg reserve is nil, for them also we are going to suggest donor oocyte. They will have good number of follicles, we will do all the IVF process, everything. Finally, we come to know that egg quality is bad or there is maturation arrest or some reason the oocyte has problem, because of which we are not able to get the embryos. In such couple also, we will suggest donor oocyte for them. The current scenario is now we are getting married at later age because we are concentrating on our studies, our career. So even after marriage, sometimes we may postpone the pregnancy. So after marriage, it's a different scenario, but before marriage, we have not found the right partner yet or we are not settled in our career yet. For such girls, it's better to go for oocyte freezing because our biological clock will not stop and wait for our career to get over or until we find our right partner. So in such cases, when it is appropriate time to do it, when should I do it? So less than 30 years would be good because they will have good reproductive capacity at that time. Less than 35 would be also okay because after 35 and above, the egg quality and number goes on decreasing because when we are born, we are already born with a set of eggs. So as and when the days goes, as and when you keep on ovulating, those reserve will keep on getting over. So some may have good reserve even after 35, but that is less chances. So it's better to opt for oocyte freezing until if you have not found your partner or you are giving importance for your career up till 35 years or good if it is below 30 years of age.